Quick note before we start. This video is for general education only, not a diagnosis. If anything here sounds familiar, the next step is a conversation with a doctor or therapist, not a label you give yourself from a YouTube video. And if you're in crisis right now, please reach out to a crisis line in your country. You don't have to wait this video out alone. About a third of adults will experience some form of anxiety disorder at some point in their life. But anxiety isn't one condition. It's a family of related but distinct disorders, each with its own trigger, its own pattern, and its own treatment path. Confusing them is more common than you'd think, because they can look similar from the outside while feeling completely different on the inside. Here's every type, mapped out completely. Generalized anxiety disorder. GAD is anxiety without a single clear target. Instead of fearing one specific thing, the mind treats almost everything as a potential threat. Health, money, relationships, work, things that haven't even happened yet and may never happen at all. The defining feature isn't the worry itself, since everyone worries. It's the inability to turn it off once it starts. A normal worry fades once the situation resolves. GAD just generates a new thing to worry about the moment the old one clears, which is part of why it's the most common anxiety disorder among older adults. There's always a new thing life can hand you to worry about. Physically, it shows up as muscle tension, fatigue, and trouble sleeping because the body stays in a low simmer of alert for hours at a time, every day, with no clear off switch. Panic disorder. Panic disorder isn't the same as having a panic attack. Most people will have at least one panic attack in their life without ever developing the disorder. What defines panic disorder is the pattern, repeated, unexpected attacks, plus a new, second layer of fear that builds on top of them, the fear of having another one. The attack itself peaks within about 10 minutes, but feels far longer, with a racing heart, shortness of breath, dizziness, and a sense that something catastrophic, often something like a heart attack, is happening right now. The average age this first appears is in the early 20s, and once it starts, the anticipatory fear between attacks can become just as disruptive as the attacks themselves, since the person starts organizing their life around avoiding the next one. Agoraphobia. Agoraphobia gets mistaken for a simple fear of going outside, but the real mechanism is more specific than that. It's the fear of being somewhere that escape would be difficult or help would be hard to reach. If panic struck, crowded spaces, public transport, bridges, being far from home. Someone with agoraphobia isn't necessarily afraid of the outside world itself. They're afraid of being trapped in it without an exit. In its mildest form, it means avoiding a few specific situations. Left untreated, it can narrow someone's world down to the inside of their own house, because eventually almost every outside space starts to feel like a place they couldn't escape from in time. Social anxiety disorder. Social anxiety is often dismissed as just shyness, but the two aren't the same thing. Shyness is a personality trait. Social anxiety disorder is a fear specifically tied to being judged, embarrassed, or scrutinized by other people. It affects roughly 1 in 8 people at some point in their life, and it's more common in women than men. What makes it distinct is how situational it is. Someone with social anxiety can be completely relaxed one-on-one with a close friend and still dread walking into a room of strangers or speaking in a meeting because the fear isn't about people in general, it's about being watched and evaluated. Specific phobia. A specific phobia is the most narrowly targeted anxiety disorder on this list. The fear attaches to one particular trigger, heights, flying, needles, a specific animal, and barely extends beyond it. This is the key difference from generalized anxiety. GAD spreads across everything, while a specific phobia stays locked onto one thing. Remove the trigger entirely, and someone with a specific phobia can otherwise function with no anxiety symptoms at all, which is part of why phobias often go untreated for years. They're easy to simply avoid rather than confront. Substance or medication-induced anxiety disorder. This type breaks the pattern of every other disorder on this list, because the cause isn't a thought pattern, a life circumstance, or a biological predisposition. It's a direct chemical trigger. Certain substances, medications, or withdrawal from them can produce anxiety symptoms that are clinically identical to the other disorders here. But the anxiety only persists as long as that substance is active in the body or the withdrawal period continues. Once the substance clears the system, the anxiety typically resolves on its own, which is the clearest marker separating it from a standalone anxiety disorder. Anxiety disorder due to another medical condition. Sometimes anxiety isn't psychological at the root at all. It's a direct symptom of an underlying physical condition, like a thyroid disorder, a heart arrhythmia, or a respiratory illness. This is easy to miss because the symptoms feel identical to generalized anxiety or panic disorder from the inside. The key distinction only shows up in treatment. Therapy or anti-anxiety medication alone won't resolve this type because the anxiety is downstream of a separate medical issue. Treat the underlying condition, and the anxiety frequently resolves alongside it. Two closely related conditions get lumped in with anxiety in everyday conversation, but the DSM-5 actually classifies them separately because their underlying mechanism is different. OCD involves intrusive, repetitive thoughts paired with compulsive behaviors meant to neutralize them. The anxiety is a byproduct of the obsession, not the starting point. PTSD centers on reliving a traumatic event through flashbacks, hyperarousal, and emotional numbing. Anxiety here is a downstream response to trauma, not a standalone condition. Both share anxiety's physical fingerprint, the racing heart, the hypervigilance, but clinically, they're built differently underneath. 7 distinct disorders, 2 close relatives, and one thing they all have in common. Every single one of them is treatable. None of this is about labeling yourself from a list. It's about recognizing that anxious isn't one experience, and understanding which pattern actually matches what you're going through is the first real step toward addressing it properly, with someone qualified to help. Subscribe for the next full picture.